Welcome to Oncology Data Advisor. I'm Kira Smith, and today I'm joined by Dr. Swathi Varanasi. Thanks so much for coming on today.
Thank you so much for having me.
Would you like to start off by introducing yourself and sharing what you do in your work?
Sure. So I'm Dr. Swathi Varanasi. I am a pharmacist and I identify as an integrative health pharmacist. And so you might be wondering, what is integrative health? So everyone has a different definition. To me, integrative health really is about this intersection and interplay of all the different possibilities for healing health and wellness. So to me, it is meeting the patient where they're at and thinking about it from what I call patient-centered shared decision making. So it's thinking about, okay, what is going to align and fit with the patient's goals, whether it's their treatment goals, their quality of life goals, but also how is it going to align with their lifestyle? So I like talking about everything from, sleep hygiene to supplementation to the safe and effective use of prescription medications and everything in between. And it's really serving as a guide for a patient to say, these are, let's say someone comes to me and they have issues with sleep. It's talking about these are all the different things that you can do for sleep and what is going to be best for you. If you do overnight shift work, for example, like sleep hygiene and, turning your lights down 30 minutes before going to bed and, like different strategies like that doesn't really suit, the way you live your life, but maybe that could work for someone else. Whereas, we could talk about different supplements or even mindfulness, different things that people can do throughout the day to really amplify the way that they're living. And so every patient is different. And so to me, integrative health really is how can I help the patient achieve their goals in the best way possible? And, integrative health is not really a normal path for a pharmacist. I hope that one day it is, but it's still kind of seen as unconventional. And so throughout my entire training, I was looking for a mentor and I found one who's out in LA, and that's where I lived for quite a few years. I moved out there and we started the first ever and still only integrative health focused postdoctoral residency training program for pharmacists interested in pursuing this path. And I'm very proud of that. And it's, something that really jump-started my whole career is focusing for, however long my residency was on these specific methodologies and topics from Ayurveda to, traditional Chinese medicine and really everything in between, and how we can look at them as safe and effective strategies to use in complement or in sometimes as a replacement. But again, it really depends the patient. And if we think of the average person in the United States or in North America, is on 1 to 6 medications, and a lot of them are working really well for people. And so if they don't want to get off their medications, but they want to improve certain other aspects about their life, then, that's where really I can play a role and figure out, look at the drug-drug interactions, look at the drug-herb interactions, and look from an evidence-based perspective as a healthcare professional to see how I can help them.
Awesome. It's really such a unique and interesting field.
Thank you.
So why did you decide to focus on integrative health and natural medicine in your work? And how did you kind of come about getting involved in it?
Yeah, so initially it was actually growing up around Ayurvedic herbs and just Ayurvedic, methodologies that we talked about in my household. So it started off there. So I always viewed healing health and wellness as this multi-prong or multifaceted approach where, maybe one day I was taking a leave for my headache and then the next day I was looking at an Ayurvedic balm for my foot pain, right? So it was, depending the day, depending on the ailment, depending on the scenario, I was using all the things. And then of course I was also, on prescription. So it's, everything in between, right? So it's figuring out how we can use all of these strategies together. And I feel like that was something that was really missing from the, conventional healthcare professional curricula. And I really thought that, especially once I delved into the literature and I found that there actually was so much research on the use of these natural remedies, that as a healthcare professional, that I thought that this was a really interesting different path that could lead me to a lot of different opportunities that could really make a difference and disrupt the space. And even as a young child, I always was interested in innovation and disruption and even entrepreneurship. So It was really like a match made in heaven of, my upbringing meets, looking at the evidence-based perspective. And then also with the trends that we're seeing in health and wellness too. I mean, so many people are interested in seeing how they can live their best lives, their healthiest lives. And so the fact that I get to play a role in that in a perhaps maybe unconventional way is also really exciting to me too. So it really was a lot of different factors that came together at the end of the day.
That's awesome. So you mentioned how integrative health is kind of an unconventional field in pharmacy. What are some of the ways that it interacts with pharmacy?
Yeah, I think that, pharmacy is so incredible. I mean, like that's one of the main things that attracted me to it was that, I knew pharmacists that were working in medical marketing. I knew pharmacists that were running, companies, whether it was independent pharmacies or supplement brands. I knew pharmacists that were, on the front lines in collaborative oncology teams. Like I knew so many different pharmacists doing interesting things. So to me, it was really this opportunity to almost forge this new path within what it means to be a pharmacist. And so I think that every pharmacist should have an aspect of what they're doing that incorporates integrative health, because it's really just thinking about the patient and it's really personalizing the therapy and individualizing the therapy to every single individual. I guess I used individual twice, but you know what I mean. So it's figuring all of those things out and all of those factors, putting them together. And I always say, and my mentor always says too, that the most dangerous supplement or drug that's out there is the one that we don't know about. So I say that in that, if we're talking to a patient, I'm like, okay, like give me your full medication list. And then after that, I always ask them for their full supplement list, their full herb list. And I ask all of those important questions because if we don't know, for example, they're really interested in taking St. John's wort, but they're also on, tacrolimus, or they're on other medications that they might be on, that's the most dangerous one because I don't know the possible, interaction if they don't tell me that they're on it. But if they tell me that they're on it, then I can know that I'm not going to judge them at all. It's just, I need to know everything that I, like that can help me make the best decision for the patient. So if you let me know you're on all of these different things, then I can let you know, all right, this is a great safe option. Maybe that one is not the best option, but because of my background in natural medicines or other integrative modalities, like let's think about these 3 other options that could be a better fit that actually won't interact with the medications that you're currently taking or the other supplements that you're taking. So I really hope that integrative health becomes not necessarily like a specialty in and on its own, which I think is amazing, but I think integrative health can fit into so many different avenues of pharmacy already, especially in oncology pharmacy.
Absolutely, definitely a lot of considerations and a lot of ways that it can fit into oncology. So what are
Absolutely.
some of the specific roles of integrative health for patients who have cancer?
Yeah, so again, one of the ways that I've really worked with oncology patients throughout the years has really been thinking about, okay, they're on XYZ medication that has been prescribed from their oncology team that fits best for the type of, cancer that they have, but they're looking to see how they can optimize their side effect profile. So that's been a lot of what I've done is, work with oncology teams. So for example, like when I was living in LA or, when I've lived elsewhere, it's, different oncologists will reach out and say, oh, so-and-so said that, they're interested in taking peppermint or, or cannabinoids, whatever it might be. They're interested in incorporating this. This is their current drug list. What do you think as a natural medicines expert, as an integrative health expert? Is this going to, get in the way of the mechanism of action of this drug? And is this going to therefore not be the right choice for them? Or does this work on a fully different system? And it's something that could actually help decrease their, nausea from therapy, or it's something that can stimulate their appetite or improve their overall sleep quality or decrease their, anxiety from their overall treatment protocol. And, there's so many different possibilities and ways that we can achieve those. You know, if we're thinking of anxiety or sleep, I mean, mindfulness is such an incredible tool that's free. And so if we think about mindfulness, maybe we add 1 or 2 supplements that fit again safely and effectively with the prescriptions that they're on. Maybe that's the right choice for that patient. Maybe other patients, what really makes them feel amazing and lifts their spirits and therefore, you know, decreases the amount of anxious feelings they have might be, you know, implementing a daily walk. So it's thinking outside of the box in different ways where it doesn't have to be, let's add this extra thing that costs this amount of money that's not going to be covered by insurance. It's, you know, what other things can we do that improve our daily life? And also thinking about nutrition. Nutrition is so important for oncology patients. You know, some medications, as we know, they are a real appetite suppressant. So thinking about how we can incorporate more vitamins, more minerals, more micronutrients into the diet is really important, especially bioflavonoids and their potential opportunity within the space too is really amazing from a preventative and a potentially curative standpoint. So, I mean, I think the opportunities are limitless, and I really hope that integrative health not only becomes its own specialty, but it also, and therefore can penetrate a lot of different spaces. I also hope that every single, you know, healthcare professional within the oncology space is thinking about these integrative possibilities for their patients too.
Awesome. I really like what you said about thinking outside the box too, because I'm sure there are so many different avenues that a lot of people might not have thought of that or something that could really help their patients.
Yes.
So for oncology pharmacists, as well as other clinicians who are interested in incorporating more of this into their practice, is there anywhere they can go to learn more?
Yeah, I mean, there are really great resources out there, but it's something that I don't see often discussed. There's not enough people talking about these are the top 5 resources where you need to go and, you know, find this information. And also there's not enough widespread access, I would say, as well to this type of information. One of my favorite resources, which is free, it's actually run by a pharmacist who's fantastic. And he is at Memorial Sloan Kettering Cancer Center, and he runs About Herbs. So it's a full, almost like online monographs, very similar to what you'd think of from, you know, almost like a package insert for a medication, but for drugs. So there's full, not for drugs, sorry, for herbs. So there's full herb monographs on, you know, this is what you need to know. This is what the research says about using these particular herbs. So that's one great resource that's free. And I'm always out there looking for free resources or low cost resources for healthcare professionals. So that's one that I really love. That's actually, you know, through a cancer center. It's an online platform, but you can also access it on your phone through a free app. So that makes it really easy when you're rounding or meeting with a patient to look something up very quickly. One of the things that I want to see more of are CE programs, specifically for the utilization of natural medicines in oncology, because I've been a part of CE programs where we've talked about natural medicines, or we've talked about integrative health, you know, for various conditions or for overall wellness, but I haven't seen or been a part of one yet that's really focused on oncology. So I think that that is like the next new exciting frontier that, you know, if we can provide something that, you know, and of course, pharmacists and other healthcare professionals are always looking for CE credit to keep up their license. So if they can, you know, learn something that's going to help their patient, they can get some credit. I think that it's a match made in heaven. I think it's absolutely perfect. So I think that's probably the next step of what I would like to see. But there are some resources out there that I would recommend. About Herbs as one of them.
Awesome. Those are some really great resources. So looking forward to sharing those with the audience for them to check out.
Yes, definitely. And another thing too, if people are interested in learning more about cannabinoids, I was very happy to be a part of a course online that's through my brand, Element Apothic. And we have a CE accredited course that is for healthcare professionals. If you're interested in incorporating cannabinoids into, you know, the daily practice of your patients for various conditions, it's not oncology specific, but I do think it could be very helpful.
Fantastic. That sounds really helpful as well.
Mhm.
Any other parting thoughts you'd like to share about your work in this field?
No, no other parting thoughts at this moment, but I really appreciate the opportunity to share more information about integrative health or integrative medicine in general, because I I really think that this is like the next step to thinking about how we can personalize therapy and really help each and every patient, not just looking at, the set protocol, not just looking at the guidelines, but how the guidelines can apply to each and every person. So yeah, I just really appreciate the opportunity because I can't wait to see more healthcare professionals incorporating different methodologies like this in their practice.
Definitely. And we're definitely looking forward to talking more with you in the coming months as well.
Amazing.